Hello, my name is Chandler Barr. First off, I would like to thank all of my colleagues for being here today for this presentation. This is a presentation based off of the National Patient Safety Goal, and what I focused on is reducing the risk of healthcare associated infections in the NICU by means of proper hand washing techniques. Alright, so the National Patient Safety Goal that we are looking at is actually goal number 7 on the latest list that came out, and this goal says reduce the risk of healthcare acquired infections. Specifically, the standard that I focused on is the one that says comply with either the current Centers for Disease Control, so CDC, and prevention hand hygiene guidelines, or the World Health Organization's hand hygiene guidelines. And the Joint Commission initiated this new list of goals effective January 2018. So how does this particular goal apply to the NICU? Well, neonates, especially preemies, with immunocompromised systems, they are very vulnerable to infections. So to prevent these infections, there's various steps that we already take to help prevent that from happening. So for example, scrubbing in before shifts, having parents stop and wash their hands thoroughly at the sink before going to their baby's rooms, also allowing no food or drinks into the rooms, and then washing hands or using some kind of alcohol-based thing on the wall before and after patient care. So let's look at a potential case scenario where this would be really important. So preemies born at 29 weeks of gestation in the NICU. The patient's placed in a draft bed, which is basically just a clear box with 2 portholes on either side that you can stick your arms in when needed to help care for the infant. The infant's temperature is being regulated by the bed, and the infant is requiring oxygen, specifically 32% on 4 liters. So the infant's parents, they visit regularly, and they have neglected to follow NICU directions on numerous occasions. So this includes forgetting to stop at the sink and wash their hands, so they're having to be reminded multiple times. Also, they, like other parents, like to take lots of photos, and that's okay. But one of the things that we're going to look at in here is the potential for the bacteria off of phones to make their way to the neonates after parents have already washed their hands. But since they're touching the phones, then touching things in the baby's room or the baby, they are transmitting that bacteria. So anyways, also the parents have brought blankets, hats, stuffed animals, all these things they've placed in the bed without asking the nurses. And then a week after being born, the infant begins to act septic. So the nurse does a septic workup, and it comes back positive for gram-positive cocci and gram-negative rods. So this baby now has an infection, and of course it's hard to say where the infection came from. You know, was it really off of their phone, or was it just something that happens to a lot of preemies? You know, who's to say? Alright, so the main question that this PowerPoint is focused on is how clean are the hands of parents and visitors after washing their hands? And are they potentially introducing infectious agents through other means like cell phones and items that they bring from home? So those are the hats, blankets, stuffed animals, all the things that they put into their beds. So part of this presentation, I looked up research from evidence-based sites, and I found 3 really great articles, so I'm just going to give you a brief description about those articles that I found. Okay, so the first one is comparing hand hygiene measures in a neonatal ICU, and this was a random crossover trial. So this article basically started off just explaining how hand hygiene is so crucial to reducing the risk for spreading the bacteria and preventing those infections. One thing that it did point out was that it said alcohol-based solutions are better at reducing bacterial counts. And this was by means of rubbing your hands together. So this is like the hand sanitizer dispensers on the walls are one in a jar on the table. This trial compared the effects and the bacterial counts of washing hands with plain soap, the alcohol. Okay, so sorry for that interruption. The video cut off due to lack of space. But picking up where we left off, so this study compared washing with soap and water, using the alcohol-based solution, and using the povidone iodine hand scrub. And what it resulted in is that it said the alcohol hand rubbing appeared to be the most effective in cleansing the skin and reducing the bacterial count. Okay, so the second article that I found, this is the one that actually really talked about the cell phone usage in the NICU. It's called Surveillance Study of Bacterial Contamination of the Parent's Cell Phone in the NICU and the Effectiveness of an Antimicrobial Gel in Reducing Transmission to the Hands. So it started off talking about the good hand washing techniques, and then it also discussed about how the organisms, the different types of organisms that appear to infect the NICU population, and it said that they're generally transmitted by hand. It talked about the importance of the good hygiene and teaching parents about good hygiene, and then it questioned about whether or not they should be allowed to bring their cell phones into the NICU. The purpose of their study was basically to determine the contamination rate on parents' cell phones in the NICU and identify the different types of bacteria they found on those cell phones. They looked at the bacteria on their hands after washing with soap and water, and then looked at their cell phones, and they even had the parents clean the cell phones with an antimicrobial gel and then tested the cell phones for any kind of bacterial growth. So the results that occurred, they found that that all the phones had some type of bacterial growth on them. Of the phones, 72%, it was just the normal bacteria that's associated with our normal skin flora. And then there were 28% that had a combination of the normal bacteria on our skin flora and other pathogens like gram-positive cocci and gram-negative rods and yeast. So ultimately, basically what it said was that the antimicrobial gel only partially worked, and in the end they could really only recommend that parents not bring cell phones into the NICU, but it said in this world everyone is attached to their cell phone these days, so that would be really hard to implement. So it advised just upping the education and informing parents of the risk associated with that bacteria and what it can do to their infant. Okay, the final article that I found is called Recommending Standards of Newborn ICU Design, and this again highlighted proper hand washing and talked about how hand washing is the number one way to prevent the spread of infection. The authors of this article also agreed that the alcohol-based hand rub was more effective than soap and water, and they said that you should do this when your hands are not visibly soiled. If your hands are visibly dirty, then you need to use soap and water. Also, one thing that it pointed out was that a nationwide policy is that in the NICU, hand washing sinks and alcohol-based hand rub dispensers must be within close proximity to all infant beds, whether it's in a room to itself or an open room with other beds. It needs to be right there between each and every bed. Alright, so after going through these, here are some recommendations. One is to just really up that education with the parents, include some handouts, videos, not only let them know of how to perform proper hand hygiene, but why it is so important. and share those risks of what can, be transmitted to their babies without this. Limit the cell phone usage at the bedside, and when using it, teach them, to wash their hands in between, or use the alcohol-based hand sanitizer. Don't just touch the phone, then touch things in the room and them. Really try to break that up. And then if you're looking to make a really drastic change, ban cell phones altogether. But like we said, that's pretty hard. And here are my references. And thank all of y'all for coming in if you weren't working to view this presentation. Thank you very much.